Good afternoon, everyone. Thank you for joining us. I'll start with the usual update on the COVID-19 statistics. An additional 2 positive cases were confirmed yesterday, which takes the total in Scotland now to 18,302. A total of 699 patients are currently in hospital with either confirmed or suspected cases of the virus, and that is 17 more than yesterday overall, but it also includes a reduction of 8 in the number of confirmed cases. A total of 7 people last night were in intensive care with confirmed or suspected COVID, and that is 1 fewer than yesterday. Since the 5th of March, a total of 4,102 patients who had tested positive and been admitted to hospital have now been discharged from hospital. However, I'm afraid that during the past 24 hours, 1 death was registered of a patient confirmed through a test as having COVID, and that takes the total number of deaths in Scotland under that measurement to 2,489. I, of course, want to send my condolences to that person's loved ones and, of course, to everyone who has lost a loved one to this illness over these past few months. I also want to thank, as always, our health and care workers. The entire country continues to be grateful to you for what you have done and continue to do. Now, I have 3 things I want to briefly update on today before taking questions. The first relates to the cluster of new COVID cases in Dumfries and Galloway last week. In total, 12 cases were identified as part of that cluster and 23 contacts have been traced. There were no new cases relating to this cluster yesterday. The view of the incident management team is that all chains of infection within Dumfries and Galloway have now been identified and controlled. As a result, I can confirm that we are today lifting the recommended travel restriction that had applied to people in certain postcodes around Gretna, Dumfries and Annan. Our advice now is that people in these areas, like everyone else in Scotland, can travel more than 5 miles for leisure purposes. However, like everyone else elsewhere in the country, they must follow strict advice summarised in the Facts campaign. In addition, people can now visit care homes in those areas in line with the same strict guidelines that apply elsewhere in Scotland. I want to take the opportunity again today to thank everyone who has been involved, both in Dumfries and Galloway and also in Cumbria, in controlling this outbreak and in implementing Test and Protect so effectively. I also want to thank the employers who enabled rapid testing of their workforces, the contacts who cooperated by self-isolating when asked, and everyone in the affected postcodes who stuck to the travel restrictions. Although we all have a part to play in seeking to avoid this, it is the case that as we continue to lift restrictions of lockdown, there will inevitably be more clusters like this one in the weeks and months ahead. So it is reassuring, while we are absolutely not complacent, to see that this one appears to have been controlled so rapidly and so effectively, and I am very grateful to everyone who played a part in achieving that outcome. The second issue I want to raise today relates to the economic statement being made by the Chancellor of the Exchequer tomorrow. The Scottish Government wrote to the UK Government on Saturday to highlight again our view that an £80 billion stimulus programme is needed for the UK economy. To put that in context, that would be roughly comparable in ambition to the programme that Germany has recently adopted. We believe that the UK's programme should tackle inequality, support jobs and have a strong focus on investment in low carbon and digital infrastructure. We've also recommended an employment guarantee for young people, a policy that the Scottish Government is looking at ourselves. And we've called for a temporary cut in VAT to boost consumption, with especially low rates for our hospitality and tourism sectors. And finally, we have proposed that Scotland should have greater financial powers, for example, over borrowing, so that we can play our own part in and shape our own response to the economic implications of the pandemic. It's worth stressing again that the Scottish Government has on several occasions welcomed policies adopted by the Treasury during this pandemic, for example, the Job Retention Scheme and this week's support for the culture sector. And I want to again say how appreciated and how welcome and how important these kinds of interventions are. We hope that we'll be able to give A welcome to tomorrow's statement as well, but for that to happen, the policies put forward must meet the scale of the economic challenges that the UK faces, and I very much hope that they will do. The proposals that we have put forward on a constructive basis are ambitious, practical and sustainable, and they, as I say, have been put forward in a spirit of collaboration and partnership, and we believe that they would benefit Scotland but also the whole of the UK, and I hope that we will see them adopted tomorrow. Now, the need for ambition in economic policy is demonstrated by the final issue that I want to briefly update on. The Scottish Government currently publishes information about the Scottish Welfare Fund on a monthly basis. The most recent report has been published today and includes information about crisis grants. These are the payments we make available for people on low incomes who are suffering an unexpected and unavoidable financial emergency. For example, if they've taken on caring responsibilities suddenly or have to pay an unforeseen bill, or if they face a sudden gap in income because they've been made unemployed and are waiting on redundancy or benefit payments. Today's report shows that the total value of crisis grant payments in May was more than 40% higher than in May last year. It also shows, however, that the value of payments in May was slightly lower than in March and April of this year, when there was a very large increase at the beginning of lockdown. Now, these increases demonstrate why the Scottish Government more than doubled the Scottish Welfare Fund in March. We knew then that the necessary public health measures needed to control COVID would cause financial, emotional and health difficulties in households across the country. But they also provide a further illustration of why we do need to see further economic and fiscal stimulus so that we can minimise the economic harm that has been caused by lockdown. And they demonstrate once again, of course, why emerging from lockdown for all of us is so essential. We cannot, and this is a statement of the obvious, we cannot go on indefinitely with severe restrictions on our economy and on our way of life. And that's why I hope to be able to confirm on Thursday that we're moving to phase 3 in our route map out of lockdown. However, and this point is just as important, it is also why we are and must continue to be determined to ensure that our emergence from lockdown is both safe and sustainable. We must absolutely minimise the risk of going back into lockdown later in the year because we have allowed the virus to run out of control again. And that risk is a very real one, and we must not ever lull ourselves into a sense that we are somehow immune from that. And if you doubt that, I would encourage you to take a look at what's happening in some other parts of the world. In recent days in Australia, Melbourne and its surrounding areas have gone back into lockdown. New cases from community transmission there appear to be higher now than in March and April. In Spain, Galicia and Catalonia are reinstating lockdown measures, so is Belgrade in Serbia. We're also continuing to see a surge in cases in many parts of the United States. COVID cases in Scotland are currently very low, down to the collective efforts of everyone. But we are still seeing some cases every day. The virus is still out there, and it will easily come back if we allow it to. As we lift the measures that have kept it under control, the risks of transmission do increase again. It stands to reason when we start to interact more, then we provide more opportunities for the virus to spread. Outbreaks and clusters, as I said earlier, will happen. But it is down to all of us to minimise the chances of them happening and to make sure that when they do happen, they don't spread. So in everything we do, particularly as we do get out and about a bit more, we should all be conscious of every possible bridge that we might be providing for the virus to spread from one person to another or from one household to another, so that we can avoid giving it those opportunities. And that's why we continue to stress our public health campaign, Facts. It summarises the 5 key things all of us must remember in everything that we do. And if these 5 things are all that you remember over this next period, please make sure that you do remember them and that you do apply them in your everyday lives. So just to run through again what they are. Face coverings should be worn in enclosed spaces such as shops and public transport. From Friday, as we go into, I hope, phase 3, face coverings will be mandatory by law in shops, with obvious exceptions for people with medical conditions or young children. They already are mandatory on public transport. Avoid crowded places, indoors and outdoors. Clean your hands and any hard surfaces that you touch regularly. 2 metre distancing from people in other households to your own remains the general rule. And self-isolate and book a test if you experience any symptoms of COVID. And don't wait to do that immediately. If all of us remember these 5 basic measures, then we will minimise the opportunities for the virus to spread as we start to get back to normal. And in doing that, we will keep ourselves safe, we will help to protect others, and undoubtedly we will save lives. So please continue to do all of these things as we slowly, carefully but steadily get our economy and our society back to normal. If we follow these measures, then we will do that without giving the virus the chance to spread again, which would take us back to the start of this. So my thanks for your cooperation to date, and please keep following these important public health rules. We'll now move to questions. I'm joined, as I very often am, by the Chief Medical Officer and the Health Secretary, but we're going to go straight to questions today, and the 3 of us will do our best to answer these questions as always. So first today is Glenn Campbell from the BBC.
Minister, you've talked about the need for economic ambition in trying to recover from coronavirus. What plans do you have for a fresh rescue package for businesses in the travel industry, with job losses today at Barhead Travel and the threat of losses in the airline industry? And perhaps for the Chief Medical Officer, can you give us your latest assessment of the countries that are under consideration for exemption from quarantine, particularly Spain?
On the economic interventions, we have, as you know, put in place a significant package of support measures for the economy generally, and particular support measures applied to different sectors of the economy. We have passed on every penny of consequentials and added to that in some respects, and we will continue to do that. We will continue to have discussions with all sectors, including the aviation sector. Aviation sector, of course, includes different strands, airports, airlines, and the wider support services there. I had a conversation last week with representatives of the sector. So with them, we will continue to discuss the approaches and the interventions that are required. We obviously, and this is not seeking to pass the buck to anybody, we take these responsibilities very seriously, but the way in which the Scottish Government is funded and the limitations on our own borrowing powers mean that we are, I'm afraid, dependent to some extent on the decisions that are taken by the Chancellor and the kind of decisions that he will outline tomorrow. The more of a fiscal stimulus that he delivers, the more opportunity there will be for the Scottish Government to pass that on here in Scotland. But we will continue on an ongoing basis, and this is not something that will end quickly, look at our own resources and our own powers to try to provide financial and other forms of support where we can. And that's something we will talk to sectors and representatives of various industries about on an ongoing basis. I'll pass over to the Chief Medical Officer on the issue of countries under consideration. That assessment is continuing. I think it's really important we do that carefully. I hear and have heard very loudly the representations made by airports, for example, but I also have to balance that with serious public health considerations. That assessment is underway. We do see, and I noted this was a point made by the Irish Government yesterday as they extended their current travel restrictions until later in July. The point that was made then is there is increasing volatility internationally in terms of levels of infection. And as we get infection to a very low level here in Scotland, and this will be an ongoing issue, we have to think about the different ways in which we can mitigate against the importation of the virus here, as well, of course, as seeking to keep it under control domestically. Gregor.
So thanks for your question, Glenn. I mean, as community transmission becomes much less across Scotland, one of the important considerations we've got to make is how we prevent fresh importations of COVID-19 from other countries. So one of the considerations that we have is how do we identify countries where that might be more likely from. Now, as the First Minister has already outlined, work continues to try to assess a variety of different countries using a variety of different data at the moment, and those discussions need to take place with the latest data, in particular recognising that, again, just as the First Minister has outlined, the situation internationally just now is very volatile. We're seeing a lot of countries, not just across Europe, but across the globe, where there are very changing pictures domestically. And we want to make sure that as we take these very important decisions, that we've got the latest information and data available to us so that we can make a very safe decision that has obviously such big implications for Scotland.
Gordon Cree from STV.
Thank you. I'm at Edinburgh Airport, where there's obviously still a degree of uncertainty. As a general principle, do you think people from Scotland should be avoiding foreign holidays this year?
I've said previously, well, let me make a couple of points. Firstly, I want people to be able to travel freely as quickly as possible. I don't like having a situation where we've got restrictions in people's way of life domestically, or we're asking people to, consider carefully where they travel to and how they travel. None of us want to be in this position, so we want to get into a better position as quickly as possible, but we have to do that safely. I said last week, I think if you are keen to have a holiday, if you live in Scotland and are keen to have a holiday and you have the wherewithal to do so, then consider a staycation this year, not just from the public health perspective, but also our own tourist industry badly needs the support of people having that commitment to it. On the issue of air bridges, I absolutely want to see us move away from a situation where we have quarantine restrictions as quickly as possible. But we have to guard against the risk that the Chief Medical Officer has just spoken about, which is importing cases of the virus here. And if we are doing that in a way that doesn't have the mitigations in place to try to stop onward spread. These are really difficult judgments. They are not easy in any way. All countries are having to grapple with this right now, and it's important that we apply as much reason and objective evidence to that as possible. I'm not, in any aspect of this, prepared to simply be a rubber stamp on decisions taken by another government. I'm not criticising those decisions, but I've got to assess them and apply judgment to them here. I understand the views of the airline industry, but the airline industry, to its great credit, is rigorous when it comes to safety in its own operations. And we mustn't forget that this decision-making process that we're going through right now is seeking to be a careful and considered one to try to make sure we continue to contain a virus that has since March taken the lives of more than 4,000 people in Scotland. So that's why I take very seriously my responsibility to apply good judgment and as much objective evidence to this as possible. Gregory Hoare from ITV Border.
Thank you, First Minister. We've spoken to the head of a wedding business in Dumfries and Galloway, and he's very keen to stress that he's thankful for a lot of the measures the Scottish Government has put in place. But when it comes to his industry, he says that you seem to have been a lot slower than with other industries. He says, and this is a direct quote from him, "We're infuriated airlines can take off as they please with 300 strangers, yet we can't host a wedding for more than 8 people, and that's outside. Our guests need at least 3 months' notice to send invitations out, yet we don't know what the route map is for us. A further update on the 23rd of July is not enough. We need a firm route map with dates." Why, for example, when pubs and restaurants can plan and prepare to reopen, are wedding businesses still waiting for that clarity? And when can you provide the route map that he says they so desperately need?
Well, as I'm sure you know, Gregory, I'll set out the next decisions in our route map on Thursday this week in Parliament. I'm not going to go into what those different decisions will be because we're in a careful process of coming to the right decisions. I understand the frustrations and the anxiety of people in every single sector right now who are still operating under restrictions. But what I would say is that is not the case because we take any of these decisions lightly. On the contrary, we are dealing here with a virus that's taken more than 4,000 lives in less than 4 months. And as we know, almost with every day that passes right now, can do real damage, even to those who don't die. We must continue to be careful. You've heard at a previous and more than one previous session where I stood here talk about the limited headroom we have. We simply can't do everything at the same time, or this virus will spiral out of control again in the blink of an eye. And we see that. I'm not here to pass judgment on the policies of other countries. I don't know in enough detail the policies of other countries to do that. But we see in many states in America right now a spiralling out of control. So we've got to be careful. I can't. We mess with this virus at our peril. And if we simply throw caution to the wind, and I can understand the pressures from different sectors, including the wedding sector, to do that, then we will all be back to square one, and all sectors of the economy will be facing longer periods in lockdown. And nobody, at least of all me, wants that to be the case. So we've got to take these decisions carefully and sensibly and in a measured way. And I know that different sectors will look at other sectors and say they're getting to open up quicker than us, and that's just part of a considered approach, but it's also part of the reality of not being able to do everything at once. What I'd say, with every sympathy to the person who you've quoted at me there, in some ways the quote illustrates the point, because the quote said that the airline industry were able to do everything they wanted. I've got the airline industry complaining that they're under restrictions and that it's making life difficult. I know how difficult this is, but it's going to be so much more difficult for everybody if we let this virus run out of control again. And don't ignore what is happening elsewhere in the world. This virus is not done with us yet, and the only way we can keep it under control is by being careful and all of us continuing to follow the advice that is so necessary. So I understand the frustration, but I would not do anybody any favours if I took my foot off the brake completely and allowed things to spiral in the wrong direction. Phil McDonald from Global.
Thanks, First Minister. Just following up on the questions about aviation and barhead travel as well. Do you feel that these challenges that are facing Scotland's homegrown travel firms will have an effect on our place in world tourism? And what do you think the effect could be on our economy in the long run without adequate support?
Well, our job is to make sure that that doesn't happen, and our job is to make sure that we do give appropriate support for different businesses and different sectors as we go forward, and that's a job that we take very seriously. But what I think would be, and all of this is difficult for every country in terms of tourism, in terms of our domestic economies, but what will be even more damaging is if we act now in a way that 3 weeks from now, or a month from now, or 3 months from now, has us having to do, and none of us can rule this out, but we're trying to avoid it if possible, because what would be most damaging is if, not too long from now, we're having to do what Melbourne has just done, what Belgrade is just doing, what parts of Catalonia are currently doing, what large parts of Florida are doing, and it's putting everything into lockdown again. That is going to be deeply damaging, and probably damaging on an even longer term basis. So none of this is easy. None of this is perfect, far from it. But we have to continually navigate a way out of this that opens things up as quickly as possible, but avoids as far as possible the risk of it all going into reverse, because that puts all of us into an even worse position than we are right now. And as I keep saying, I have to take with my colleagues in the Scottish Government these decisions, however tough they are, and it's not a popularity contest and can never be seen as one. We've got to take the right decisions here, or as right as possible, no matter how tough and at times unpopular they are, because at times like this, that is your fundamental duty to the country, to try to keep it as safe as you possibly can. Neil Pooran from PA.
Thanks, First Minister. Several pubs in England have had to close again shortly after reopening, after some customers tested positive for coronavirus. Will checks be carried out here in Scotland by the Scottish Government or local authorities on pubs to ensure they're taking details of customers as they should in case similar cases come up here?
Well, the obligation has been made clear on pubs and restaurants. So we'll set out more about some of the mitigations that will require to be in place, for example, to allow particular premises to operate at less than 2 metres physical distance, and we'll set that out on Thursday. But it is vital that those contact details are taken in order that if cases are identified, Test and Protect can operate the way we need it to operate, and we'll set out more details of how that will work in practice later this week. I mean, I think, you know, I've read the reports of pubs in England, and I think it's important, I think, to do two things simultaneously. Take that seriously, because like many of the other examples I've been talking about today, it's a reminder that this virus hasn't gone away. But at the same time, you know, take some comfort from the fact that systems are operating to get on top, hopefully get on top of outbreaks before they manage to spread. And Test and Protect is a key part of our approach to doing exactly that. Daniel Sanderson from The Telegraph.
Thank you very much, First Minister. Just on the issue of air bridges, you've previously explained that you're happy with the countries that the UK government has categorised as green, but have some concerns over some of the ARBA countries. Can you just explain, why can't you publish the list of green countries, just so at least people who want to go on holiday would have a bit of certainty, and keep the ARBA ones under review? Because I checked yesterday with the Scottish Government and the Department for Transport, and they've sort of refused to give that information. Thank you.
Well, we may do that, but as I've said, I think every day for the last few days, we think that the green countries will be possible for us to align our position with, but there's still a process of analysis and assessment that we have to complete. So when we complete that, we will make that decision. I understand the impatience here, but you know, we must take these decisions properly. I cannot, and if people want a First Minister that is just going to be a rubber stamp for decisions taken elsewhere at any point, but particularly where she has a concern that those decisions may not be absolutely the right ones, given the circumstances we face in Scotland right now, then that's not me, I'm afraid. It's just not how I'm going to be, and I don't think I'd be doing my job properly. So we need to do that careful analysis. We need to weigh up the risks and benefits ourselves, and we need to come to a considered view overall. That's the duty I owe to every single person out there, and even although, you know, airports and airlines express frustration with that, I actually think it's a duty I owe to them as well, because I am not going to be doing anybody any favours if I take decisions that in my gut I think are taking inordinate risk and then sending us all backwards in this process of recovery. So I'll continue to take decisions in the most reasoned, considered and responsible way I can, and you know, whether they're popular or not, that's the duty I'm going to continue to try to discharge. Chris Musson from The Sun.
Hi, First Minister. Just on air bridges and quarantine, why could Wales manage to get systems in place to start contacting incoming air passengers on June the 16th, but Scotland couldn't until today? Because, I mean, you're clearly showing a real sense of caution over air bridges, but on this directly related issue of quarantine, there doesn't appear to have been the same degree of focus. Can you see how this leaves you open to accusations that you're playing politics with this?
No, I don't actually. I'm sure you have checked this, and I'm only speaking from my memory of this, because my responsibility is Scotland, not Wales, but from my memory, and I'll be corrected if I'm wrong here, Wales are not doing it the same way Scotland as of this morning is doing it. I think they write a letter to people as opposed to do the sample checks that we will be doing, but it's up to Wales to set out how... I didn't say that, First Minister. I said contacting them. That's okay, all I said. I said contacting. Sure, but what I'm saying is it's a different system, so that may partly explain why there's different... time being taken to do that. We have had to put in place a memorandum of understanding. I set out yesterday why it's taken the time to do that. It's now in place. Checks have started this morning and they will continue, and I think it's an important part of the assurance process. But as I said yesterday, the fact that the sample checks only started today does not mean that we think there hasn't been compliance with this system, but we will now do those sample checks. And I guess the other point which I made yesterday, which I'd make again today, and it is not, I stand here every day answering questions, I have no problems at all. In fact, I welcome and embrace the questioning and the scrutiny. It's an important part of what we're all going through right now. But I would also urge a little bit of perspective on this. We have in Scotland, as of now, and I'm not complacent about this, what we judge to be an infection level that's 5 times lower than elsewhere in the UK and England in particular. So all of that says, of course we get things wrong and we've made mistakes and we'll no doubt make more mistakes, but a bit of perspective would say that our overall approach is clearly having some success, because it is driving infection rates at the moment to a level that is lower than elsewhere in the UK. So just a bit of perspective sometimes. But on the point about the time for the Memorandum of Understanding, I think we set out fairly clearly the process that we've gone through. That is now in place, and as I say, the checks have started this morning. In terms of Wales' position, I think it's better to let the Welsh Government speak for themselves. I'm speaking as you would expect me to for the Scottish Government position.
First Minister, can I just double check on something you said there? You talked about the prevalence again being 5 times lower in Scotland than England. Can you just, you've used that figure repeatedly, can you just tell us where that figure is from?
That's the figure from Morden. We can certainly give more information on exactly how that is calculated. That's the modelling that we do that takes account of incidence of cases, prevalence and the other stats that we produce. But if you're interested in more of the explanation around that, we'd be happy to have the statisticians provide that for you.
Thank you.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. One for the interim CMO, if I may. You may be aware of figures from ONS this morning showing something like 22% of people show no symptoms when they test positive. I believe it's based on test figures in England. I just wondered if you had sort of comparable figures or understanding of what the picture might be in Scotland, and also just your reaction to that figure, if I may.
So thank you. Yeah, I mean, we've known that people can test positive for this virus and not display active symptoms. But I think it's probably more complex than that, even than just to say no active symptoms, because some of them will truly remain asymptomatic throughout the course of having this virus. Some will go on to develop the symptoms which we most closely associate with the virus, the cough, the fever, the loss of the taste or the smell. And what they've tested they've tested in a pre-symptomatic phase of that infection. And some more will have what we call post-symptomatic, or very few or mild symptoms, which may not be the classical symptoms that we associate with as well. So this has been a phenomenon that we've known for some time. And we're gaining much more knowledge now in terms of the relative infectiousness of each of these periods as well. It's now felt that truly asymptomatic people probably have a very little role to play in driving the pandemic and in spreading transmission. And we know that people who are have very limited symptoms are perhaps more able. It's those patients who perhaps are most symptomatic that are perhaps able to kind of spread and transmit this virus most readily.
Alistair Grant from the Herald.
Hi there, thanks very much. I just wondered if there are any enforcement figures or information following the opening of beer gardens yesterday. For example, did the police have to shut any premises down, disperse people or issue any fines? And if so, are there statistics or figures for this?
I am not aware of any instances of that, but I don't have figures from the police from yesterday. We can certainly get those from the police and make them available if there are any instances of that kind of enforcement activity. Tom Peterkin from the P&J.
Good afternoon, First Minister. Boris Johnson has said that too many care homes didn't really follow the procedures in the way they should have, and it was later explained that this was in reference to the transfer of asymptomatic people into care homes. This has caused a huge amount of anger amongst unions, amongst others, who've accused him of covering up his government's failings. But Unison is still saying that that this problem with transferring untested people into care homes from hospital has also been a problem in Scotland. I just wondered what your thoughts were on what the Prime Minister said, and B, on the criticism that untested folk were transferred into care homes.
I'll hand over to the Health Secretary to say a word about this as well. I'll let Boris Johnson speak for himself. I'll speak for myself. And you've heard me talk about the care homes issues at length umpteen times in the past. I mean, the first thing I would say is overall it is the government that's responsible for our response to this pandemic, and in the fullness of time there will no doubt be a look back at the things we got right and the things we got wrong. Mistakes will have been made, and I've readily accepted that. Equally, we will have done some things that we did at the time based on the best information we had. If we had the information we have now, back then we might have done things differently, but you can only act on the information you have at the time. So that's the first point. But the second point is, I suppose, in that category of things that we acted on the basis of the information we had, is this moving knowledge around asymptomatic transmission, which the Chief Medical Officer has just talked a little bit about. But there was also the balance of risk. We knew at the time that older people who were delayed in hospital, in other words, they didn't have a medical need to be in hospital. Had they remained in hospital, they could also have been at risk of patients with coronavirus coming into the hospital. So there were no easy options back then, and we acted at the time on the basis of the best evidence we had. We put in place guidance for care homes around isolation and solitary dining and infection control to make sure that those risks were being mitigated. But all of that, I think it's really important that there is a very candid look back at all of that. And the other point that we've made all along is that this should not ever be about pointing the finger of blame. Government's ultimately accountable and responsible, so I'll be clear about that. But in care homes, again, you've heard me say this, the government, care home providers, local authorities, public health teams locally, we've all had a part to play. And I think in the main, we have worked well together. Care home providers fulfilling their responsibilities and the Scottish Government stepping up, whether that was additional PPE or now the work that's been done around testing. So, I think it's really important that we see that the collective efforts that have been so important through this, but in the fullness of time, all of these things will be scrutinised rightly and properly so that we understand issues of accountability, but also learn any necessary lessons for the future. Jeane.
I think there's only a couple of points to add to what the First Minister has said. The first of those is to always remember, of course, that no one is discharged from hospital, both before the pandemic and throughout the first phase of it, without to a care home or indeed to their own home, without a clinical assessment about the appropriateness of that discharge and the setting that they're going to, that is undertaken both by the hospital but also by the care home if that is where they're going. The second point I think that is important, or there's probably three, so the second of the three is that testing is important, but as important, if not more so, is good practice in terms of infection prevention and control. That applies in care homes as it does in hospitals. And the guidance that First Minister has mentioned that was issued on the 13th of March sought to reinforce the importance of those measures as well as introducing other mitigating steps, including no communal dining and so on. And I think the third point, of course, to make now is that testing is undertaken before discharge, but remembering that there is a balance to be struck between the risk that someone, particularly someone who is elderly, faces if they stay in a hospital setting longer than they need to. That is a risk, of course, from COVID infection in the early stages of the pandemic, but it is also a risk in terms of their mobility, their frailty, their cognitive function. Everyone recognises that staying in hospital, particularly if you're elderly, longer than you need to, is not the best place for you to be. So those decisions were taken then, as the First Minister says, and as matters have developed and we have understood better with our partners in the care home sector the additional steps that were needed, then we have taken all of those steps from providing PPE to providing additional guidance, support from our primary care sector that is enhanced, and of course testing.
The one thing, just to round this off, that is beyond any debate, doubt or argument is that the people working in our care homes, just like the people working in our National Health Service, have done the most outstanding job in the most difficult, stressful and trying of circumstances, which is why every day I express my gratitude to them, and I know that is a feeling of gratitude that is shared by everybody across the country. Gina Davidson from the Scotsman.
Hi, thank you, First Minister. Just going back to the economy for a minute. Yesterday, a Social Market Foundation report showed which areas of Scotland were most likely to be hit by the looming economic downturn as a result of coronavirus. And as you said earlier, the Chancellor is expected to make various announcements tomorrow, which will result in Barnett consequentials, particularly, it's believed, for local authorities. Now, there was a row earlier on, about April time, that the government hadn't passed on money to councils quickly enough to deal with coronavirus. Will you say today that this money, if any money comes to Scotland, you will pass it on quickly, directly to local authorities? And there's also a claim that there's going to be around 345 million in unclaimed business support grants. Will you pass that money also to councils to help support local businesses and the economy?
Well, firstly, we have passed on every penny of consequentials to councils, and indeed given additional support over and above that. We've done that as quickly as possible. We've also front-loaded some of the money councils get this year in order to give them access to that. We've given a commitment, I've given it several times, on the business the money for businesses, that every penny of that will go to businesses. I gave the same commitment earlier on this week to money for arts and culture. And remember, this is money that is funded by Scottish taxpayers in the same way it is by taxpayers in other parts of the UK, and largely, of course, at the moment funded by UK borrowing. The Scottish Government doesn't have that ability to borrow, which is why we have to rely on the Treasury to do it. I'm going to stop short, I'm afraid, unless you've got more information about the consequentials that are going to be announced tomorrow than I have. I'm going to stop short before I commit to spending money that I don't yet know we have. I think people can look at what we've done so far in giving 100% commitment to passing on consequentials to see that that will be a commitment that we make in future, but I'll wait and see what the Chancellor announces tomorrow before I start making commitments, because I think it's important we see what that adds up to and exactly what that is for. But we'll give our view on that as soon as we know what the position is. Rachel Watson from the Daily Mail.
Thanks, First Minister. On June 23rd, Hamza Youssef told the Health Committee that approximately 20% of travellers had been contacted for follow-ups on quarantine rules, but those hadn't started yet, and he is going to correct the record on that. He also said that Police Scotland had told him that there was very high compliance, even though they hadn't started, and Ian Livingston has said that Police Scotland aren't informed of breaches. I just wondered if you could explain where that confusion comes from, and if there is further confusion that these follow-ups were actually happening.
Well, I mean, Hamza will write to the committee on the first part of that, as he has said himself. The information he got was the information he thought was the case at the time. That is, 22nd of June was when we had intended that these checks would start, but because of the reasons around the conclusion of the Memorandum of Understanding that I narrated yesterday, that took longer, and the checks have now started. On the issue about compliance, as I understand it, what he was referring to at the time is that at that point the police had received no reports of non-compliance with the self-isolation requirements. I am advised, and obviously we will continue to look closely at this information, that as of today, actually 6 reports of suspected non-compliance have been received by the police. But at the time Hamza talked about high compliance, there had been none received, and that is what he was referring to. But he'll contact the committee, if he hasn't already done it this morning, to make sure that those points are understood.
Can I just double check with the point on police being informed of the breaches? Has there been a change in that policy from the SPA meeting last week, when the Chief Constable said that they wouldn't be informed of breaches due to information sharing?
I will double check whether there's been any change and confirm that to you. I am looking at information I've got just now that says that as of today they've had 6 reports of suspected non-compliance. Obviously, once the sample checks are done, if there is any reason to suspect through those that there are people not complying, then there will be the possibility of passing those on to the police as well. But I'll double check whether there has been any change to that operation or not. Andrew Learmonth from the National.
Thanks, First Minister. You'll have seen that Dr Donald McCaskill from Scottish Care has written to all members of the Scottish Parliament asking for the idea of a national day of mourning to be considered. I wondered if I could get your thoughts on that, and if you think that's something that could be worthwhile, or if the Scottish Government are thinking of any other ways of remembering those who have died from coronavirus.
We'll consider that suggestion very carefully. I think I've said before, and it remains my view, is that at an appropriate point, with whatever engagement with relatives of those who have died is possible and appropriate, we will absolutely, as a country, collectively, want to remember and mark the loss of life. And it's there have been, I know I've heard over the past couple of months, different suggestions as to how that would best be done, and I think we've got to sensitively and carefully consider that. But the suggestion that's come from Scottish Care is certainly one that we will consider. But the question of if we do this, I don't think is in doubt. I think the question is how that is most appropriately done, and obviously we'll listen to different views on that, particularly I think the views of those who have been bereaved as a result of COVID. Mark McLaughlin from The Times.
Good afternoon, First Minister. Yesterday, Sir John Curtis said the Sunday Times poll demonstrated that many Scots during the coronavirus crisis have started to wake up to the power of devolution for the first time in 20 years, and may have made them hungry for more powers. So in light of that, looking back, should you have charted a different course in early March from the Four Nations Action Plan? We know why I did at the time, simplicity of messaging and all that stuff. Should you have done that earlier? And looking forward, will you put in your manifesto a pledge to ask for a second referendum in 2021?
This is a briefing to update the Scottish public on coronavirus, and I'm not going to go into other issues. I don't think it would be... You asked me if I'm going to put something in my manifesto. This is not an opportunity for me to talk about elections or manifestos, and I'm just not going to do that. This is an opportunity. It's really important that people watching these briefings, whatever their politics, whatever their views on the Scottish constitutional question, they can listen to the Scottish Government, update them and answer questions on coronavirus. And I'm not going to take this briefing down that political or constitutional road. And I suppose that is my answer to the first part of your question. At no stage have I, and at no stage will I, judge the decisions that I am making to try, to the best of my and the Scottish Government's ability, manage this pandemic. At no stage will I take those decisions on the basis of political or constitutional judgments. The only thing that matters to me is trying to get through this as safely as possible, with minimising the loss of life as much as we possibly can, keeping people safe and getting the country safely onto the other side of this. And I will continue to make these judgments driven by public health considerations and, of course, the considerations around the economy and the other harms that we know lockdown have done. And people can have different views. They can think I'm right or wrong about that, but I'm afraid they're not going to shake me from that. Politics and constitutional debates, where I look forward, because it will mean the pandemic is over, we can get back onto these debates rigorously in our normal way, hopefully maybe being a bit more polite to each other, learning the lessons of kindness and solidarity that have been taught to us through this pandemic. But for now, that's not what drives my decisions, and it's not going to be what drives my decisions. And I'm afraid that's just the long and short of it. Paul Mallock from the Courier. Are you there,
Thank
Paul?
you, First Minister. 25,000 laptops meant for children at risk of falling further behind their peers are still sitting in boxes unused. Do you regret not getting these learning aids into the hands of the children in Scotland when they needed them most, as promised by the government, and the potential this could have on undoing the work in closing Scotland's attainment gap?
If it was as you've just characterised it, then maybe. But what we're doing is working with councils to identify the children most in need, the children who are most digitally excluded. There's no simple data set that allows us to do that. So we want to make sure these devices get to those who will benefit most from them. And the aim is that they are allocated in that way before the new school term starts. So that process is underway, and we're investing in total, I think, around £30 million in trying to close that digital gap, because we know going forward that pandemic aside, actually, but more important because of the pandemic, giving more deprived children better access to online learning and online activities is really important. So that consideration is underway with local authorities. That concludes the questions for today. Thanks to the CMO and to the Health Secretary. My thanks to Anna, our BSL interpreter from today. My thanks as always to the journalists for joining us. And lastly, thank you to you. I will leave you with my usual plea, which is if you are going out and about a bit more now, remember facts, face coverings in enclosed spaces, shops and public transport in particular. Avoid crowded places. If you turn up somewhere, even outdoors, and it's crowded, leave again. Clean your hands regularly. If you're touching hard surfaces, clean them regularly as well. 2 metres distant from people in other households will help protect you too. And self-isolate and immediately book a test if you have the symptoms of COVID, which, just to refresh your memory, is a new cough, a fever, or a loss of or change in your sense of taste or smell. And you can book a test at NHS Inform on that website. If we all do all of these 5 things, then despite the challenges of all of this, we will be able to progressively open things up as we have been doing, but keep the virus under control as well. So my thanks to you for that, and I will see you again here tomorrow at the usual time of 12:30.